Medical imaging has revolutionized healthcare, providing us with unprecedented views inside the human body. These technologies allow doctors to diagnose diseases, monitor treatment progress, and understand the complexities of human anatomy and function in ways never before imagined. From simple X-rays to sophisticated techniques like PET scans and MRIs, medical imaging has become an indispensable tool for modern medicine. Before the advent of these technologies, diagnosing internal problems often relied on invasive procedures or observations of external symptoms. Imaging techniques offer a non-invasive and often painless way to visualize internal structures and processes. This ability to see inside the body has dramatically improved diagnostic accuracy and treatment outcomes. Medical imaging encompasses a wide range of techniques, each employing different principles to create images of specific body parts or functions. X-rays, for instance, use ionizing radiation to visualize bones, while ultrasounds utilize sound waves to produce images of soft tissues and organs. MRI, or magnetic resonance imaging, uses powerful magnets and radio waves to generate detailed images of the brain and other soft tissues. Functional MRI, or fMRI, goes a step further by measuring and mapping brain activity, providing insights into brain function and connectivity. Electrocardiography, or ECG, records the electrical activity of the heart, helping in the diagnosis of various cardiac conditions. Each technique offers unique advantages and is suited for specific diagnostic purposes. As technology continues to advance, we can expect even more sophisticated imaging techniques to emerge, further enhancing our ability to diagnose and treat diseases. This constant evolution underscores the vital role of medical imaging in shaping the future of healthcare. The human brain is a complex network of billions of neurons that constantly communicate through electrical signals. Electroencephalography, or EEG, is a remarkable technique that allows us to eavesdrop on this intricate electrical symphony. By placing electrodes on the scalp, EEG records the brain's electrical activity, providing valuable insights into its function. EEG is commonly used to diagnose and monitor various neurological conditions, including epilepsy, sleep disorders, and brain tumors. It is particularly valuable in diagnosing seizures, as it can pinpoint the location and type of abnormal electrical activity in the brain. This information is crucial for neurologists to determine the cause of seizures and develop appropriate treatment plans. One of the key advantages of EEG is its excellent temporal resolution, meaning it can detect changes in brain activity that occur over milliseconds. This makes it ideal for studying dynamic brain processes, such as sleep stages and cognitive tasks. Moreover, EEG is a non-invasive, painless, and relatively inexpensive technique, making it widely accessible. However, EEG has limitations. Its spatial resolution, or its ability to pinpoint the exact location of brain activity, is limited. This is because the skull and scalp can distort the electrical signals detected by the electrodes. Additionally, EEG primarily reflects activity in the outer layers of the brain, the cortex, and is less sensitive to activity in deeper brain structures. Despite these limitations, EEG remains an invaluable tool in neurology and neuroscience research. Its ability to capture the dynamic electrical activity of the brain in real time provides crucial insights into brain function and dysfunction. Muscles contract and relax in response to electrical signals from the nervous system. Electromyography, or EMG, is a diagnostic technique that measures these electrical signals, providing valuable information about muscle health and nerve function. By understanding the electrical language of muscles, doctors can diagnose a wide range of neuromuscular disorders. During an EMG procedure, small needles are inserted into specific muscles. These needles act as electrodes, detecting the electrical activity generated by muscle fibers during contraction and relaxation. The electrical signals are then amplified and displayed on a screen, allowing doctors to analyze the pattern and strength of muscle activity. EMG is particularly useful in diagnosing conditions that affect the nerves controlling muscles, or motor neurons, or the muscles themselves. These conditions can include nerve compression, such as carpal tunnel syndrome, nerve damage from injuries or diseases, and muscle diseases like muscular dystrophy. One of the significant advantages of EMG is its ability to differentiate between muscle problems caused by nerve dysfunction and those originating in the muscles themselves. This distinction is crucial for guiding treatment strategies, Additionally, EMG can help assess the severity of nerve damage and monitor the progress of nerve regeneration. While generally safe, EMG can cause some discomfort due to the needle insertion. Patients may experience mild pain or cramping during the procedure. However, these sensations usually subside quickly once the needles are removed. EMG, when combined with other neurological tests, provides a comprehensive assessment of muscle and nerve function, playing a vital role in diagnosing and managing neuromuscular disorders. Positron emission tomography, or PET, is a sophisticated imaging technique that provides a unique window into the body's metabolic processes. Unlike other imaging techniques that primarily focus on anatomical structures, PET scans reveal the body's functional activity at a cellular level. This capability makes PET an invaluable tool for diagnosing a wide range of conditions, including cancer, heart disease, and neurological disorders. During a PET scan, a small amount of a radioactive tracer is injected into the bloodstream. This tracer is attached to a molecule such as glucose that is naturally used by the body's cells. As the tracer circulates, it accumulates in areas of high metabolic activity, such as cancer cells, which tend to consume glucose at a faster rate than normal cells. The radioactive tracer emits positrons, which interact with electrons in the body, producing gamma rays. These gamma rays are then detected by the PET scanner, which creates detailed three-dimensional images of the tracer's distribution within the body. These images provide valuable information about the metabolic activity of different organs and tissues. One of the most significant advantages of PET scans lies in their ability to detect diseases at an early stage, even before anatomical changes become visible with other imaging methods. For instance, PET scans are highly sensitive in detecting cancer and determining if it has spread to other parts of the body. This early detection is critical for timely treatment and improved outcomes. However, PET scans also have some limitations. The use of radioactive tracers, although in very small and safe amounts, raises some concerns, particularly for pregnant women and individuals with certain medical conditions. Additionally, PET scans are relatively expensive compared to other imaging modalities. Despite these limitations, PT scanning remains a powerful tool in modern medicine, providing crucial insights into the body's metabolic processes and aiding in the diagnosis and management of a wide range of diseases. Single photon emission computed tomography, or SPECT, is a nuclear imaging technique that shares similarities with PET scans but offers a simpler and more cost-effective approach to functional imaging. Like PET, SPECT uses radioactive tracers to visualize metabolic activity and blood flow in different organs and tissues. However, the tracers used in SPECT emit gamma rays directly, eliminating the need for positron-electron annihilation that occurs in PET. During a SPECT scan, a small amount of the radioactive tracer is injected into the bloodstream, and it travels to the target organ or tissue. The gamma camera then rotates around the patient, detecting the gamma rays emitted by the tracer. A computer then processes these signals to create three-dimensional images of the tracer's distribution, revealing areas of increased or decreased blood flow or metabolic activity. SPECT is commonly used to diagnose a variety of conditions, including heart disease, bone disorders, and brain disorders. For instance, in cardiology, SPECT can help assess blood flow to the heart muscle, identifying areas of reduced blood supply that may indicate coronary artery disease. In neurology, SPECT can aid in evaluating brain function in patients with dementia, epilepsy, and traumatic brain injuries. Compared to PET scans, SPECT offers several advantages. SPECT scanners are more widely available and less expensive to operate. The tracers used in SPECT also tend to have longer half-lives, making them easier to handle and transport. However, SPECT images generally have lower resolution than PET images, which may limit their ability to detect small abnormalities. Despite this limitation, SPECT remains a valuable tool in clinical practice, providing valuable information about organ function and blood flow in a cost-effective and accessible manner. Its role in diagnosing and monitoring various conditions underscores its continued relevance in modern medicine. If you found this information helpful, consider sharing it with others or discussing it with your healthcare provider. Don't forget to subscribe to our channel for more insights into advanced medical imaging techniques.